Good evening, New Salem. Welcome to Wellness Wednesday. We're going to get started in just a minute. All right, so welcome to Wellness Wednesday. I'm your host, Paulette, and this evening we have the pleasure of having Dr. Ward joining us. He was going to give you some information once again of COVID-19. He's a urologist, so he'll give you some facts about that for men and women. But I'm going to go ahead and turn it over to him. Per usual, feel free to put your questions inside of the chat, and once he's done doing his presentation, we'll go through your questions and answer those for you. Thank you.
Well, good afternoon, almost evening, everyone. So this is unusual for a urologist because urology, even though we see both men and women, the problems in urology for men and women are very specific to men and women. So it's hard for me to give a general talk about urology. So what I'll do is two things. I will talk to you about what urology is so that you know if you need a urologist or if some of your problems would be addressed by a urologist. And also I will talk about the viewpoint of practicing as a surgeon in this age of coronavirus and what this means for me as the provider and for you as the patient. So first of all, urology deals with the entire urinary system, but I'm a surgeon for that, meaning kidneys, from the kidneys all the way down through the bladder. Now, obviously men and women have very different anatomy and therefore very different problems. For men, the primary issues I deal with are prostate cancer, erectile dysfunction, kidney stones, and there are some overlap. Women get kidney stones as well, bladder cancer, testicular cancer, and just general difficulties with urination, whether you're going too frequently, not going frequent enough. Also, as men get older, they get large prostates. So all men eventually will need to see a urologist, either for their prostate or for some erectile problems or something like that. In women, again, women can get renal cancer just like men. Women can get bladder cancer just like men. And incidentally, the #1 risk factor for any cancer in the urothelial tract is smoking. So the one advice I could give all of you is do not smoke. That is probably, and that's going to help you with a lot of your other health conditions that you may be dealing with. But also with women, we will deal with specific things to women like urinary incontinence related to coughing or sneezing. And both men and women can have overactive bladder, which about 40 million people in the United States have. And that's a condition where you urinate too frequently, you urinate, you can't hold it, you're getting up at night to go. All of these things can be related to overactive bladder, and that's what urology deals with also. So for women and men, the problems are a little bit different. So I wanted to give that overview, and then that way I can answer specific questions that any of the viewers may have related to them, whether it's a man or male or a female problem. Now, let's shift to what does the coronavirus situation, what has it done to healthcare from my perspective? #1, what it has done, it has reduced access to healthcare for pretty much everyone. And also that's frustrating for providers. And what do I mean by that? Well, initially when this outbreak started, we could only see emergent or urgent problems. And that was it. No elective things, which again, most of what most physicians do are elective management things, long-term management of chronic illnesses, or monitoring their condition that they already have. And so that's a big chunk of what any physician does. And of course, that went out the window. Then what happened was we started doing virtual visits. And those are good, except you can't touch a person, you can't do a physical examination. There are some limitations with virtual visits. And so even though we still do some of them, we're fading away from doing that because there are certain shortcomings. One of the things that's happening now is that we're seeing patients be reluctant to re-engage with the healthcare system. And for good reason, right? Because you think, well, I mean, if I go out of my house, I got a chance of getting the coronavirus. And so that's understandable. but we've made adjustments and we've made concessions. So now what happens is any patient going to see a physician will have their temperature checked and will be questioned for the basic symptoms of coronavirus. Any patient getting surgery has to be tested for coronavirus officially, and they must be, so that we know whether they're COVID positive or COVID negative, and then we make concessions based upon that. If you're COVID positive, we have a special operating room only for coronavirus positive patients at the hospitals. And if you're COVID negative, well, that makes everyone feel a little bit better. Now, there are some shortcomings, however, and you all may have been hearing that access to testing is not as easy or widespread as some would like us to believe. I mean, yes, some places offer free testing and you can go and get tested, but it's not that easy. And to this day, providers are not getting tested very, very frequently. In fact, I've never been tested, and I've taken care of hundreds of patients since this all started. And it's not that easy. At this point, at least at Ohio Health, providers can only get tested if they think they've either been exposed to someone with coronavirus or they have some sort of symptoms, such as a fever, shortness of breath, things like that. Otherwise, it's really, access is not voluntary. So that's been one of the challenges. So one message I will tell you is it is safe to re-engage in the healthcare system. We are all taking precautions. Everyone is wearing a mask, for example, and we'll talk about that, the importance of masks. But at least understand that it is safe for you to do it. You're being screened. In fact, if you're having problems, you're likely going to be detected whether or not you have coronavirus by re-engaging with the healthcare system. So that is very important. Now, one of the things we're noticing is that some people will wear their mask and some people are very reluctant to wear their mask. So general statistics, and now we're learning so much more about the importance of masks. For example, if the person without coronavirus, so if you don't have coronavirus and you wear your mask, that decreases your chance of contracting the disease by 30%. Good, not great, but good. If the person with coronavirus wears a mask and you who don't have it doesn't wear a mask, that decreases your risk by 95%. So it is clearly critical for everyone to wear a mask because you can have it and not know it. So really the mask stops the coronavirus carrier from spreading it to others, 95%. Much more effective than we thought. Now, one final point. If both sides wear masks, if the person with the virus wears a mask and the person who doesn't have it wears a mask, your chances of getting the virus go down to 1.5%. So that is 98.5% effective at preventing the spread. So clearly, if we all wore masks for a while, this virus would go away. So the problem we're having in the United States is a failure of leadership from the top, causing confusion, causing a chunk of people not to wear a mask. And we're hearing a lot of misconceptions, things such as young people won't get it, and if they do, they won't get sick. We don't know that. We don't have statistics. We don't have enough data to tell anyone that they're either immune or that they can not be very sick from this disease or even die. There have been deaths of pretty much all ages. It's certainly at a higher percentage as you get older. And so above 65 is the highest risk category. But things like comorbid factors, high blood pressure, diabetes, heart disease, if you smoke, all of these things cause issues. One myth I want to dispel is that somehow African Americans, there's something wrong with us, making us get this disease at a higher rate, and that's just not true. There are cultural factors that are causing this. Things like the inability to socially distance as effectively, because many times we live in closer quarters. Number two, more comorbid factors. It's the comorbid factors that make us more susceptible. Number three, many more of us are considered what they would call essential workers, let's say. And so that means you don't have the ability to stay at home and tap away on your computer and work many times. So if you're in any service industry, you're an essential worker. And now basically they're holding people like that hostage because what they're telling them is if you don't come to work, you're fired. If you're afraid, too bad, you'll lose your job. And not only that, you won't be eligible for unemployment benefits. So that's really why we're seeing higher rates in certain communities. So there's nothing inherently different physiologically between people other than these other factors that they may have. So that's important to know. So that's really what sort of my general points I wanted to put out there. Just understand that, you can get back to seeing your healthcare provider. That's very important. We have too many people not being monitored, not having their blood pressure monitored regularly, their diabetes, all their other chronic medical conditions because they're afraid to go to the physician. And virtual visits sometimes just get you access, but it's not the same as being with your physician. And let's face it, you can't do surgery with a virtual visit. So if someone needs an operation, that needs to happen in person, face to face. And if you need an examination, that needs to happen face to face, as is a certain amount of testing that we're doing. So it's important to have confidence in the healthcare system. We're taking lots of precautions to make it safe for patients to re-engage, and also safe for the providers. We all should be concerned about this virus. It is very serious. We are clearly not doing our job in the United States. For example, yesterday, the United States had the record high number of cases since this started, 60,000 cases. The European Union, so the United States has roughly 330 to 340 million. The European Union has 440 million people. That means 23 countries, 100 more million people. Yesterday, they had about 5,000 cases. So we had 60,000 new cases, they had 5,000 new cases. And this is not all just from testing. That's not true. It is because we haven't taken the steps to prevent the propagation or the spread of this virus. So I wanted to put these general guidelines, these general points out there. I'm more than happy to take questions and comments and go from there. I think from a urology standpoint, it would better to field questions, because men and women, it's just too difficult to talk specifically to certain issues in urology, because it's really going to exclude a large chunk of our viewers. So I'll open it up for questions.
We haven't received any questions in the chat yet, but I do have a question myself. Do you think it's important for us to get the antibody test? So I know a lot of us are getting tested right now for the actual virus, but
right.
Should we get tested for the antibody?
Well, I think antibody testing will be important. What we're finding is that, so there are lots of things. This is a novel virus, meaning it's new. We don't know a lot about it. Yes, if you can get the antibody testing, that's great, because that'll tell you if you had it and didn't know it. So maybe you had, you just didn't feel well for a couple of days, and you were one of the lucky people that had a minimally symptomatic episode or an asymptomatic episode. And that's where the antibody testing will help. What we're finding and what they're seeing in other countries is that you can become reinfected. And we don't know at what rate that is. And so that's what's going to make it so hard to have a vaccine. So we don't have any therapies, right? Nothing that has been studied and proven to be effective. There are things we're using, but much of the treatment is based on the symptom profile of the patient and how severe they are. Hydrochloroquine, it's been taken off the table by the World Health Organization, the CDC, the FDA. They've removed that. Remdesivir may be helpful in really sick patients, but remember, most people won't be ICU level sick. They're going to be like, I don't feel good, I feel really bad for a couple of days. And then you may think it's nothing. And so if you don't get tested, you'll never know. And you could become an asymptomatic carrier after that. And so you're right, the antibody test would be great, especially if you don't have any symptoms, because it will tell you if you've had it. The test for the coronavirus probably has a high negative rate if you're asymptomatic. That's where the antibody test comes in.
We have questions as a medical professional. What are your opinions on the reopening of schools and the safety of visiting your dentist?
So here's the thing so we'll start with the schools. It is going to be, from what the latest information is suggesting, schools will try to open, but all people will be wearing masks. And they're going to try to socially, so some of the strategies, everyone with a mask, social distancing of the students, some sort of hybrid model where not all the kids are there at the same time to decrease the number of students that are present. And so that's what we're likely going to see, but no one really knows yet. And I do think there's some risk. You have to weigh the risk of educating these kids more effectively versus the risks of this virus. Because remember, what this last several months showed us was that these kids weren't learning as well. That's been proven. They were not learning as well. We have parents who work. Think about what a nightmare. I don't know if you have kids, but when my kids were young, what a nightmare if we had to have them be home and not be at school. School is daycare for a lot of parents. While they work, the kids are at school. So now you got to have someone be there to take care of your kids if they're below a certain age and make sure they're engaging in the academic system with whatever format we're using. I just saw a statistic in, I think, some of these big cities, some of these large metropolitan cities, up to 30% of people don't have high-speed internet. So if you don't have 30%, if you don't have high-speed internet, you can't engage with the system. And so that's a problem, right? Because this is all done online. I talked to the principal of Reynoldsburg school system, or the superintendent. What they did was they had mobile hotspots. They were taking to different neighborhoods. I guess they were like these buses or trucks that could be like a hotspot for like that little area. And say what they were trying to do that to allow people to have access to high-speed internet. But again, that's a challenge. And so one of the things we know is we can't educate these kids with our current resources without them going back to school. So that's the challenge for us all. And we don't know the answer to that yet. I know the California school system, the university system, they already said they're not going back, whereas they haven't announced that everywhere. That's the other problem. There's no uniformity in how we've dealt with this virus. As if we have, walls around each state and people can't go interstate, there's no interstate travel. So it's never made any sense. So the answer is, those are the things that are being talked about for schools, but we don't simply know how they're going to be implemented and if it's going to happen for sure. And the second question, part of the question, so the schools and...
Dentist.
Pardon?
Visiting your dentist.
Okay, yes. So yes, okay, dentist presents a special challenge, right? Because your mouth's wide open, you're breathing through your mouth, there's a lot of vapor, there's drilling, which they think can be air, because we know that this virus can be aerosolized. So when this first started, what the surgeons had to do was wear what's called an N95 mask. And that's a mask that filters out 95% of all particles, everything. And so before we started COVID testing all of our surgical patients to know that they were negative, we were having to wear N95 masks. Some doctors are still wearing an N95 mask because there could be false negative testing. So what can you do when you're a dentist? You can't put a mask on. So what you're going to find is your dentist and their hygienist and all of those people there will likely be wearing N95 masks, which, as we said, will keep them from transmitting it to you. So you're safe to go to the dentist. You're a bigger risk to them than they are to you because you can't have a mask on and be at the dentist, but they can. So now that we know how effective masks are, I think the dentist is safe.
Okay. Can the virus live on surfaces, and how long can it live on it?
Great question. So, we were all walking around like the boy in the plastic bubble when this first started. And so what we now know is that surfaces it's hard to get a high enough viral load from surfaces, to cause a real issue. Yes, it can live on surfaces, and they've proven it can live up to, first we thought, okay, it's maybe 5 or 6 hours. It could be a day or two, but the question is the viral load high enough? So one of the things about getting an infection is you have to have enough of a load of whatever that source is to give you the infection. And so the viral load may be too low. Well, I heard a great analogy called the 3 W's. W number 1, wear your mask. W number 2, wash your hands. W number 3, watch your distance between people. That's another way of saying physical distancing. I wish we would have called it physical distancing from the beginning and not social distancing, because what we've seen is people feel disconnected because they can't be around people. Their social networks and routines have all been changed. It's physical distancing. So you can be around people, you just can't be, within 6 feet of them safely without face masks. So wear your mask, wash your hands, watch your distance.
We have a viewer who said that their general practitioner says she has kidney cysts and stage 1 chronic kidney disease and needs to see a urologist. Due to her corona concerns, what will this visit be like? How invasive will it be?
So it won't be invasive. Typically, kidney cysts are benign, and we don't do anything about them unless they show characteristics. So we want to make sure several things. Number one, are the cysts truly benign? We categorize renal cysts into four categories. And the first two categories are considered benign. The second two categories are considered pre-malignant or potentially malignant. So if it is truly a benign cyst, there's no intervention. It's non-invasive. And keep in mind, renal cysts in and of themselves should not affect your kidney function unless you have a genetic condition called polycystic kidney disease. And in that instance, sometimes it can affect renal function. In this situation, that person will need to have primarily a nephrologist involved. That's a medical doctor for the kidney, not a surgeon. Those are the ones who do dialysis. They monitor your medications and your renal function more specifically and manage that function. As a urologist, we're mostly there for the surgical portion. So if this cyst is benign and does not require surgical intervention, then the urologist role becomes minimized or maybe not necessary.
They had a part two to that question regarding avoiding getting kidney disease stage 2 and 3. That would be a question for their nephrologist, correct?
That would be a question for the nephrologist. However, I can give you some general comments about kidney, just things you can do to have healthier kidneys. Number one, avoid dehydration. Drink water. Drink enough water that your urine looks clear. When people think you think you're drinking enough water, but if you're sweating all day in your job or you work outside, you got to drink 3-4 times the amount of water that you may have to otherwise, because you're losing water, what we call secondary or insensible losses. Sweating, so what's called respiration and perspiration and GI tract. Those are ways that you can lose water. So hydration is number one. Number two, try not to go on any high protein high protein diets. Protein is difficult for your kidneys to process sometimes, and you need protein, but you don't. Most of us take in more protein than we need. And so if you have normal kidney function, you'll probably be okay. But if you have kidney impairment, you need to maybe back down on some of your protein intake. And that's one of the things a nephrologist will tell you. Third, some medications are what we call nephrotoxic, meaning these medications they're metabolized in the kidney. They can put a strain on your kidneys. And so this is something that would be monitored by the nephrologist. They would take a look at your medications to make sure you're not on any nephrotoxic medications. They'll talk to you about some dietary guidelines and things like that.
This viewer would like to know, do you think that this virus is going to be around in a part of our lives forever, or do you think it will be eventually eradicated?
So I think this virus is going to be around for a while. We don't know if it's going to be around forever. We do know that other countries are doing a much better job. So once the transmission rate goes below 1, that means one person infects less than one person, the virus will die out. And when this thing first started, one person was infecting 3 to 5 per people, right? It's now down to like 1.5 to 2. So we're getting better, but we're nowhere near where we need to be. And the United States is woefully, well, it's us, Brazil, number 1 and 2, the worst. And then I think like Great Britain and some others. But generally speaking, it will be around for a while. We probably won't see a vaccine till sometime in 2021. Effective. Now, don't listen to the politicians. These vaccines take a long time to develop. You want them to take a long time to develop because you want them to be tested and proven to be effective. Well, I'm not just going to rush out. And if some vaccines rush to the market, we need to be cautious, right? It needs to be tested in a lot of people, and we need to make sure it's safe. The other thing is viruses mutate, and that's why sometimes you can get the flu virus and still get the flu, because these viruses mutate, and that's why they change the flu vaccine each year. The CDC is monitoring which strains it looks, because the flu is a coronavirus also. Remember, this is the technical term for COVID-19 is SARS-CoV-2. They call it COVID-19 is because it was found in 2019, and it's a coronavirus, so they just shortened it to COVID-19. And the more accurate term is SARS-CoV-2, because the regular flu is a coronavirus, the common cold is a coronavirus, they're all in that big family of viruses. So, and it could evolve. So it may be till next year before we really see a vaccine that's effective. So forever, probably not. For the foreseeable future, yes.
Going back to the question regarding schools, do you think that schools should provide more than one nurse moving once they move students back into the to schools?
Well, so here's the thing. If you think about this, this is more so because it's a public health issue. This isn't really necessarily about nursing care as much as it is about procedure and process and how you do things, and that doesn't necessarily require a nurse. It's just all about protecting people, distancing people, monitoring people, testing those who you are suspicious might be infected or have been around someone who's been infected, and then doing what we call contact tracing. That's really, and those are more administrative procedural things, and that's not necessarily what the nurse will do. I think if the nurses become overwhelmed with students coming with complaints, then yeah, they need to get more people involved. Well, by and large, it's going to be about keeping an eye on these kids, educating everyone, the teachers and the all the people that are working with these children to look for signs and symptoms, and encouraging kids to learn how to protect themselves. That's really more important than the number of nurses.
Well, that was the last question that came in. I want to give our viewers a few more seconds just to,
Sure.
if you have any other questions, to drop them inside the chat. While they're doing that, Dr. Ward, do you have any other information you would like to share with the viewers?
Well, I think I gave you, I'm looking over my notes here. General urology things we went over. Hydration is the key to keep your kidneys healthy. Every person should see their primary care physician annually, even if you're healthy. And I would say anyone over 20, get a primary care doctor. 85% of high blood pressure is genetic. You inherit it. You don't do anything to get it. So you could start having that in your 20s. So see your primary care doctor once a year and make sure that you get a full physical, including a urine analysis, which as a urologist is important because many things start out as microscopic blood in the urine, meaning blood you don't see that shows up on a test. You would never know it if you didn't get a formal UA or urinalysis. The other thing is smoking. Smoking doesn't just cause heart disease. It doesn't just cause lung disease and lung cancer. It causes bladder and urothelial cancer. If there's been some estimates that if you eliminated tobacco products right now, you would dramatically reduce heart disease, vascular disease, cancers of all kinds. And so it is truly important to not smoke. It's probably the healthiest thing you can do for yourself is not smoke.
How many times should we get tested?
Well, it depends on exposure. I mean, we don't want people feeling like they need to be tested every week. If you think you've been around someone or if you're displaying any symptoms, then you should get tested. The short answer is we don't know how frequently people should be tested. But we know that we need to be testing more people than we have. Clearly, had we tested every American, it would have been cheaper than the trillions of dollars that we have doled out that some of these high, billionaires and corporations that didn't need it got money from. So this has just been a failure. I mean, we could have tested everyone. That was that, but that wasn't the goal, and that wasn't in the plans. So the answer is I don't know how often you should be tested, but I do know if you have any symptoms, if you've been around someone who exhibited symptoms or tested positive, yes, you should be tested. That's part of the contact tracing, or you should at the very least closely monitor yourself, and maybe you should quarantine if possible. And again, this is tough. Telling someone to stay home for 2 weeks and you got to work. Good luck.
It's so hard.
Yes.
And then the last question is, for those of us who have pets, can the virus be transferred through our pets?
The good news is we have not. I have pets too. I have a dog. We have not seen, there's not been any reported cases of this going to household pets. Although this virus likely did jump from an animal species to a human species. And we all kind of know the story about all that happened in the Wuhan, China, and the wet markets and all of that. But the answer is your household pet should be fine.
Yep, that was the last question. The other ones that are coming through are just saying thank you to you and great information. So we truly appreciate everything that you've given us today. Thank you so much.
Well, I hope this was helpful, and I'd be happy to come back anytime. If you want to know, and a lot of times it'll be like a men only or a women only thing for urology. because then men can talk about their erectile dysfunction. They're not going to do it on Facebook Live, or something like that. But that we get a lot of that.
Well, we appreciate you. Thank you so much. Have a wonderful evening.
You have a wonderful day. Take care.
Bye.
Bye-bye.